Okay, please be silent. And please stop talking. So this is a very important lecture. Okay, so this is the last lecture for me also. Okay, and it's very important. And from the next semester, another 2 sets of doctor will be taking for your batch. Okay, so now coming to the lecture, and as I said in the starting, it is very important. When you face it, it will be of emergency situation. It will be of emergency situation. So the topic here is called infarction. The topic here is called infarction. Inshallah, and after this lecture, you can able to define infarction and list the types of infarction and what are the factors can influence the formation of infarction, and you can able to describe the morphology of infarction in various organ. Okay, before starting, let us discuss certain basic concepts. So consider this is the blood vessel and it is supplying the organ. For example, we take it as a heart. Okay, if the blood flow to the heart muscle is reduced, what it is called as? See, if the blood flow to the heart is reduced, okay, blood flow to the heart is reduced, it is called as ischemia. It is called as ischemia. So ischemia will produce, so now the blood flow we can call cardiac blood flow. Okay, cardiac blood flow is reduced, it will leads to, it is a ischemia, it leads to, okay, hypoxia. It leads to hypoxia. This hypoxia will lead to what type of necrosis? Mashallah, coagulative necrosis. Okay, let us take another example. This is the blood to the kidney. So this is called renal blood flow. Renal blood flow to the kidney is reduced. Ischemia happening in the kidney, right? Ischemia happening in the kidney. That will leads to what? Hypoxic state to the kidney. Hypoxic state to the kidney. That leads to what type of necrosis? Coagulative necrosis. Assalamu alaikum, brother. In the lecture, brother. After finishing, I call you. Huh? I will call you. Okay, brother. 2 o'clock I call you. Huh? So you understand the concept here. If the blood flow is reduced to the organ, that will create ischemia. That is the ischemia, right? So if ischemia is happening, that will reduce oxygen, right? That will reduce the oxygen to the tissue. That will leads to cell death. So ischemia causing cell death is a necrosis, and except brain we see all the organ coagulative necrosis. So ischemia, if ischemia means reduced renal blood flow, reduced blood flow to any organ, reduced blood flow to any organ. If that ischemia is happening due to thrombus, this is a blood vessel, there is a thrombus formation, a blood clot formation, and it is causing occlusion, right? You all know occlusion. Occlusion means something obstructing the blood flow. So there is a obstruction, occlusion in the blood flow, okay, causing ischemia, causing necrosis, causing coagulative necrosis, is called infarction. Is called infarction. Once again I am telling, see, renal blood flow or any blood flow to the organ can be reduced to many reasons. Can be reduced to many reasons. If it is due to occlusion, if it is due to occlusion, occlusion means something obstructing the blood flow, something obstructing the blood flow. Here I am telling example of thrombosis. Here I am telling the example of thrombosis. See, we have a blood vessel, okay, and now this is normal. So here there is some thrombi is forming. Thrombi is forming. It is called occlusion. It is called occlusion. So the blood flow is occluded because of thrombi. Because of thrombi. So what will happen? That will produce ischemia. That will produce ischemia. Ischemia will produce hypoxia. Hypoxia will produce coagulative necrosis if it is not a brain. Okay. So this whole process we name in a single word. It is called infarction. It is called infarction. So infarction is something, if somebody asks you to define, no need to memorize. If there is any occlusion in any part of the blood vessel, whether it is vein or artery, if there is occlusion in any part of the blood vessel, that produce ischemia, if that produce hypoxia, if that produce coagulative necrosis, it is called infarction. It is called infarction. If it happens in the heart, it is called myocardial infarction. If it happens in the kidney, it is called renal infarction. If it happens in the spleen, it is called splenic infarction. If it happens in the lung, it is called lung infarction. Understand? So the concept is same. What is the principle here? There is reduction in renal blood flow. The reduction or any blood flow, it could be of any reason, but if it is due to occlusion and it produces coagulative necrosis, it is called infarction. It is called infarction. So infarction is an area of ischemic necrosis. So you see, we are giving the definition here. Ischemia, infarction means it is an area of ischemia creating necrosis, ischemic necrosis due to occlusion of either arterial or venous drainage. Arterial blood supply or venous drainage. Any blood vessel, if there is occlusion that produce ischemia, that produce necrosis, it is called infarction. It is called infarction. 99% of the infarction happens due to thrombotic event or thromboembolic event. If you see the last lecture, we discussed about thrombosis and embolism. So thromboembolism means thrombi getting break into small pieces. That is called thromboembolism. Okay. So there are two types of infarction. If the infarction appears red in color, it is called red infarction. So it happens in certain conditions. Okay. It is if there is venous occlusion, or it happens in a loose tissue like lung, or if they have two circulation. If they have dual circulation, for example, lung has two circulation. What are they? One is pulmonary vessel, other one is bronchial vessel. So, or if the tissue is having congestion. So these are the reasons for red infarction. Now coming to the white infarction happens in arterial occlusion. If the artery is occluded, there will be white infarction. And if it is a solid organ, exactly opposite. If it is a loose tissue, you see red infarction. If it is a solid organ, you see white infarction. And example, heart, spleen, kidney. Okay, heart, spleen, kidney are very solid organ. If you see the lung, it is like a spongy. Okay, it is a loose tissue. And if they have end arterial circulation, so they have single artery supply. For example, heart has single artery, coronary artery supply, that's all. Okay, they don't have two arterial blood supply. If they have two dual circulation, then it will be red infarction. Okay, if it has single arterial circulation and it is occluding the artery and it is a solid organ, it will end up with white color infarction. If the infarction is infected by bacteria, it is called septic infarction. It is called septic infarction. And so it is due to bacterial infection. Bacteria grows in the infarct. Okay, so infarct, that area will be, if it is infected, that whole area will become like a abscess. Okay, there are some factors influence the development of infarction. Once again I tell here. So infarction means there is a blood supply to, for example, this is the heart muscle. So this is the blood supply to this heart muscle, and this is going for thrombi formation, occlusion. then it reduces the blood flow here. Blood flow is reduced. That will create what? Ischemia. That will create necrosis. That will create necrosis. So this is infarction. This is infarction. Okay. So there are four factors influence the infarction formation. One is nature of blood supply, nature of blood supply, and speed of occlusion, rate of development of occlusion, which means how fast the occlusion is happening, how fast the occlusion is happening, and vulnerability of hypoxia, oxygen content in the blood, oxygen content in the blood, and some tissue. Vulnerability hypoxia means, there are, I'm giving three examples. We'll take three tissues. One is skeletal muscle, other one is cardiac muscle, and other one is brain. Okay, if you stop blood supply to the skeletal muscle, you all know skeletal muscle. Yes. If you stop blood supply to the skeletal muscle will not die immediately, will not die immediately. Yani it will take 4 hours. If you stop blood supply to the cardiac muscle, it will die after 40 minutes, and approximately. Okay, if you stop blood supply to the brain, it starts dying in 4 minutes. Easy to remember, just I am telling 4. Okay, so if you take average, it is 4 to 6 hours, 20 to 40 minutes, and 4 to 6 minutes. Okay, but easy to remember, just keep it as a 4. See, if you stop blood supply to the skeletal muscle start dying, going for necrosis after 4 hours. Cardiac muscle after 40 minutes. Brain after 4 minutes. Why? What? Yeah, see, don't bother about whether it's right or wrong. Just put your thought. Because there's muscles has? Mashallah, muscle has glucose, right? See, another two things can bring energy, because remember the cell injury chapter, I told if the glucose is stopped, immediately mitochondria utilize, if the oxygen is stopped, immediately the mitochondria utilize the glucose to produce energy, right? ATP. So any tissue which stores glucose, they survive for some period. Okay, so brain doesn't store anything. Okay, brain that truly depend on the coming blood supply. Okay, if blood supply is stopped, immediately the brain starts dying. So that's why the necrosis happens in the brain in 4 minutes. Necrosis happens in the brain in 4 minutes. Whereas cardiac muscle, they store some amount of glucose, so that's why they start dying after 40 minutes. Whereas skeletal muscle, they store large amount of glucose, so they start dying after 4 hours. Okay, so this is what we call vulnerability to hypoxia, withstanding the hypoxia. So let us discuss one by one, very important, because questions will come from this 4. Okay, now coming to the nature of blood supply, I am making it very simple. I told lung, right? Lung has one blood supply comes from pulmonary circulation and another blood supply comes from systemic circulation. This is called bronchial arteries. This is all you should know from the anatomy. So lung has two blood supply. One is from the pulmonary artery, other one is from the bronchial artery. So if pulmonary artery is blocked, then they can get blood from the bronchial artery. So they survive more. So the nature of blood supply to an organ determines whether the organ can go for infarction or not. If the organ, for example brain, has supply by cerebral artery, okay, if cerebral artery is occluded, then the brain doesn't have another blood supply, immediately they go for necrosis. Okay, so that's what I explained here. The lung has dual blood supply, pulmonary and bronchial artery. So obstruction of small bronchial artery does not cause infarction, because they get blood supply from the bronchial circulation. Whereas liver, it has do again two artery. Okay, one is hepatic artery, other one is portal vein. So they survive because of two circulation. Whereas in the hand and forearm, again they have two blood supply, radial artery and the ulnar artery, so they survive. So whereas in the kidney, spleen, as well as in the heart, they cannot survive because they have only single circulation, that is called end arterial circulation. That is called end arterial circulation. So how to summarize this? Any organ which has two blood supply, they survive more. Any organ which has single blood supply, if that is blocked, they will die. It's very simple, right? So it's logical. So that is nature of blood supply determines whether they can go for infarction or not. Now coming to the speed of occlusion. Now we have a blood supply to this muscle. If the occlusion is happening very fast, okay, then the infarction happen immediately. Infarction happen immediately. Understand? I'm telling. This is thrombotic occlusion. This is thrombotic occlusion because the clot formation happens rapid. The clot formation happens rapid. I think in physiology you would have done the bleeding time, clotting time, right? The clotting time is how much? 5 minutes. Okay. So, inshallah, please study and tell in the lab. Okay. I will come to the lab and I will ask this. Okay. So, see, what I am trying to tell is it happens in a minute. It happens in a minute. Actually, I am just giving a homework so you can go and study the physiology. So, this is called thrombotic occlusion, very rapidly occluding blood vessel, very rapidly occluding blood vessel. I am going to show you another example. This is the blood. I draw separately. And these are the very important concept we ask in the exam. That's why I'm doing lot of things to explain. Please understand. We take two blood supply. Okay, one is occluded by clot formation, that is thrombus. So thrombi will happen very fast. So the infarction happens immediately. Infarction happens immediately. Any doubt in this? Okay, now let us take another condition. This is the blood vessel. What is this? Endothelial cells. Okay, let us concentrate on one side. So this is what? Basement membrane. Okay, below the basement membrane we have smooth muscle cells. What? It's not coming. See, if it's not coming, please tell, because I'm not seeing the board. Okay, so what is this? This is smooth muscle cell. Okay, it happened to me, I think last year when I was drawing and I was explaining, and it was nothing is displayed there. At the end of the class the students told how funny it is. Okay, so please tell me, any understand? So yeah, I hope inshallah it comes. See, now I'm little bit explaining in this blood vessel because the mechanism is different. Occlusion mechanism is different. Okay, so it is supplying the heart. Example, we'll take it is supplying the heart muscle. Now this guy, okay, is having high lipid in his blood. What happens? The lipid goes to the blood vessel wall, right? The lipid goes to the blood vessel wall. Now it is not occluding. Now it is not occluding, right? Okay, just it is going inside the wall. Then its lipid level is not reducing. It is keep on increasing. So now they start occluding. They produce lot of lipid inside. You all understand? Okay, now it is started occluding. It started occluding. See, now lumen is reduced. It will happen for years. It will happen for years. So slowly it will start occlusion 10%, 20%, 30%. 40%, 50%, and some people survive even with 90% occlusion. Some people, actually, even my father is having in major vessels 90% occlusion. Subhanallah, Allah's qadar, so he is surviving, alhamdulillah. So what you have to understand is, he said that he will not go for surgery. Okay, so tawakkal to Allah. So like that some people are. So what I am trying to tell is, some people have, what I am trying to tell is, please understand the rate of occlusion. Okay, so rate of occlusion in certain mechanism, it is rapid. For example, thrombotic occlusion. For example, thrombotic occlusion. If it is due to fat getting into the blood vessel, slowly it increasing, it is happens for years. It happens for years. When the occlusion, rate of occlusion is very slow, very insidious, stepwise, very slow, what happens is, now the blood supply going to the heart is reduced. You understand? Slowly it is reduced. It's not immediately occluded. Slowly it is reduced. Once again I am telling, if the person is having high lipid, the fat goes to the blood vessel wall. Slowly after a few years it occludes. So occlusion starts like 5%, 10%, 20% like that. So what happens when the occlusion is increasing? The blood flow is decreasing. The blood flow is decreasing. Up to this, everybody understood? Okay, the blood flow slowly decreases, right? When the blood flow slowly decreases, this heart muscle sends a signal. Okay, it sends the signal to this blood vessel to develop branches. To develop branches. For example, this heart muscle sends signal to this blood. I will draw once again. Okay, see, now this is heart muscle, this is another heart muscle, okay, receiving the blood supply, and this guy is having increased lipid, same person, okay, it is happening in the same person. So is all the blood is having high lipid. So what happens, the fat comes down to the blood vessel wall and slowly it increasing, right? Slowly it increasing, but it is affecting only this vessel, it affecting only this vessel. This vessel is good, this vessel is good, nobody knows why. Okay, this vessel is good. So what happens is, slowly this heart muscle suffer because of reduced blood flow. Up to this it's clear? Okay, then what it does is, this heart muscle sends signal to this blood vessel, okay, and this blood vessel give a branch, it grows branch and it connects. Understand? So this is called collateral formation, anastomosis. Okay, so yani it is really Allah's help. So this signal goes to the blood vessel, and another blood vessel which is good, it gives a branch to the affected blood vessel, so they get enough blood supply. This can happen. Why my father is surviving? Because this is happening to him. Understand? Because even with 90% occlusion, okay, because he is having good collaterals, good anastomosis, so he is getting enough blood supply. Understand? So what you have to understand here is two things. If the rate of occlusion is fast, example thrombotic occlusion, then infarction is immediate. And if the rate of occlusion is slow, infarction may be delayed because of collateral formation, because of collateral branching formation, because of collateral formation. So this is the concept I am explaining here. Okay, so slowly developing occlusion are less likely to cause infarction because they provide time for the development of alternative perfusion pathway. Alternative perfusion means branches, alternative perfusion pathway. So this is the same thing I explained, I am explained here. Okay, so you can read. So now coming to the vulnerability to hypoxia, how far they can tolerate hypoxia. Okay, for example, I told neurons, they can tolerate hypoxia for maximum 3 to 4 minutes, they will die. Myocardial cells, heart muscle cells, they can tolerate 20 to 30 minutes, and it varies from book to book. Some book says 20 to 40 minutes, some book says 20 to 30 minutes, some book says 40 to 50 minutes, but take it as average 40 minutes. Okay, it's easy to remember. Okay, so now see, For example, fibroblast or skeletal muscle cells, they can survive for many hours. They can survive for many hours. Okay, connective tissue cells, they can survive for many hours because they have glucose in them. Okay, so this is called vulnerability to hypoxia. It depends upon what are the other energy resource they have. What are the other energy resource they have. Now coming to the most important one is oxygen content of the blood. Okay, for example, I give you a, this is a lung. Okay, please listen, Annie. So this is lung. Okay, and this person is a smoker. This person is a smoker. His lung is affected. He cannot take enough oxygen. He cannot take enough oxygen. Do you think is, and this is a person of smoker. Okay, and this is a person of a non-smoker. Okay, who will have good oxygen in the blood? Non-smoker, definitely, right? So this person, his blood vessel is having some occlusion, some occlusion. And see, this is about smoker I'm talking. Okay, already he has less oxygen, right? Because he is a smoker, he cannot have good lung capacity, so automatically he has less oxygen, and he is also developing occlusion. He is also developing occlusion, and this guy is a good person, normal person, healthy person, and he is also developing occlusion. Who will be affected more? So this guy will be affected more. Okay, so the partial pressure means amount of oxygen in the blood determines the infarction formation. Understand? If the person has less oxygen in the blood and when the occlusion is happening, infarction will happen fast. The person has normal oxygen level in the blood, occlusion happening, infarction will be delayed. I can tell even in the female, it is very common. Okay, because global data says that females are more anemic than the male. Okay, so for example, consider this is a female. Okay, this female is having less hemoglobin. Okay, the female is having less hemoglobin, which means they cannot have enough oxygen carrying capacity. So this female have less oxygen, so if the occlusion is happening, the anemic female will be affected more. Anemic female will be affected more. So this is what you have to understand. Okay, so oxygen content of the blood determines the formation of infarction. Okay, now coming to the morphology of infarction. So morphology of the infarction will be wedge shaped. Okay, wedge shaped means like this. Okay, triangular shape. So it's like a wedge shape. Okay, so here this is the blood vessel will be occluded here. So infarction forms like this. Understand? So occluded vessel will be at the apex. So this is the apex. So you can see the occluded vessel there. So the infarction will be forming like a wedge shaped infarction. See here, this is the infarction. So it is red color, it is called red color infarction. It is white color infarction, it is a spleen. And this is the lung. And you all know why in the lung there is red color infarction, because of dual blood supply, and why in the spleen it is white color infarction, because of single blood supply. Because of single blood supply. So infarction will have coagulative necrosis. Histologically they will have coagulative necrosis. So this is the heart infarction. You can see white color because of single artery circulation. Because of single artery circulation, once it get infected, you can see abscess formation. It is called septic infarct. Okay, now coming to the concept of hyperemia and congestion. Hyperemia means increased blood flow to the arterial slide. Okay, if the person is doing exercise, more blood flow will be on the arterial side. Increased blood flow due to arteriolar dilation, it is hyperemia. Okay, if there is more blood occluding in the more blood staying in the venous side, it is called congestion. It is called congestion. If the right side is not functioning, right side of the heart is not functioning, that leads to congestion of the blood in the venous side. that leads to congestion of the blood in the venous side. Very simple, Yani. So hyperemia means more blood goes towards the arterial side. Congestion means more blood stay in the venous side. More blood stay in the venous side. Example, right heart failure. Remember, right heart failure. Here you can simple example, exercise. The person is doing exercise, you can see more blood is needed for the muscle, so there is increased blood flow to the arterial side, increased blood flow to the arterial. So this is the normal. So if the arterial side gets more blood, we call hyperemia. If the venous side the blood is getting more, it is called congestion. It is called congestion. Now coming to the hemorrhage. So hemorrhage means bleeding. In simple word, it is a extravasation means vesation means blood vessel. Extra means it's coming out of the blood vessel. So it is nothing but it's a simple bleeding. So the bleeding can happen in the body cavities. If it happens in the thorax, it is called hemothorax. If it happens in the pericardium, it is called hemopericardium. If it happens in the peritoneum, in the abdomen, it is called hemoperitoneum. If it happens in the joints, it is called hemoarthrosis. Okay, there are three types of bleeding name we give. One is called petechiae, very important. So it will be a small bleeding spot, 1 to 2 millimeter in size. It can be seen in the skin, mucous membrane, and purpura means larger than the petechiae, 3 to 5 mm. Why I am telling this is, if anybody is coming to you for dental treatment, if they have such kind of bleeding spot, don't do any treatment. Don't do any treatment because they may have low platelet count, or they may have defective platelet or clotting factor deficiency. Understand? So don't touch the patient. Okay, if you see any bleeding spot in them, okay, so check their bleeding time, clotting time, APTT, PT, then you can test, you can do any examination, you can remove the teeth, or you can do any drilling or anything. Understand? Okay, so don't touch the patient if you have any doubt that their body surface is having some bleeding areas. Okay, so you have to check immediately platelet count, APTT, PT. I think in the last lab syllabus we would have discussed APTT and PT. You have to discuss, you have to do that. Then only if it is normal, then you can do the treatment. Okay, if it is increased, don't do the treatment. Now coming to the ecchymosis. Ecchymosis is a large hematoma. Hematoma means large area of bleeding, 1 to 2 centimeter, and so usually it happens in injury. When somebody fall, they will get a big blood vessel rupture, more bleeding will happen. Okay, so keep this in your mind. This is very important. So look for the bleeding spot in the face because you are going to examine the teeth, right? So easy to look for it. Okay, especially in the children, especially in the children. Okay, so anyhow, any